Hello everyone, welcome back to Pharmacon tutorial. Today I am with few MCQs that will definitely help you in competitive examinations. And in this session I have included questions from general pharmacology and autonomic nervous system. So let's get started. Now here goes the first question, who is known as the father of modern pharmacology? The options are option A, Oswald Schimmelbusch, option B, J. Langley, option C, Rudolf Beckham, and option D, Paul Ehrlich. All of the scientists mentioned here are well known in the pharmacology field. And the correct answer for this question is option A, Oswald Schimmelbusch, who is a German pharmacologist and who put forward many fundamental concepts in pharmacology. Now discussing the other options, J. Langley is a scientist who studied chemical receptor theory. Rudolf Beckham is the teacher and mentor of Oswald Schimmelbusch. And Paul Ehrlich is the father of modern chemotherapy. So the correct answer of this question is option A, Oswald Schimmelbusch. Now moving on to the second question. Which one of the following antiplatelet is a prodrug? Option A, aspirin. Option B, dipyridamole. Option C, ticlopidin. Option D, abscimab. Drugs that are inactive as such and need conversion in the body to one or more active metabolites are called prodrug. And these prodrugs are more stable, have better bioavailability and desired pharmacokinetic properties with less side effects. And here in this option, the correct answer is option C, ticlopidin. This ticlopidin is a prodrug that requires conversion into active thiol metabolite by a hepatic cytochrome P450 enzyme. So the correct answer is option C, ticlopidin. Moving on to the next question. A highly ionized drug, option A, is excreted mainly by kidney. Option B, can cross the placenta easily. Option C, is well absorbed from the intestine. And option D, accumulates in the lipid. The correct answer for this question is a highly ionized drug is excreted mainly by kidney. That is option A. So this is because a highly ionized drug is not reabsorbed by the tubules and it is easily excreted by the kidney. This is because of its lipid insolubility. Question number 4. Sildenafil is contraindicated in patients taking following class of drugs. Option A, alpha adrenergic blockers. Option B, beta adrenergic blockers. Option C, organic nitrates. And option D, ACE inhibitors. This drug sildenafil, it is a phosphodiesterase inhibitor mainly used in the treatment of erectile dysfunction. This drug is contraindicated with organic nitrates, that is the option C is the correct answer, organic nitrates, because this may cause risk of severe hypotension when taken along with the sildenafil. So sildenafil should be avoided in patients taking organic nitrates. So next question number 5. All of the following are selective beta blockers except option A, atenolol, option B, esmolol, option C, bisoprolol, and option D, sotalol. Here the correct answer is option D, sotalol. The other drugs, atenolol, esmolol, and bisoprolol, all are selective beta-1 adrenergic blockers. This sotalol is a beta blocker with membrane stabilizing effect. Moving on to the question number 6. Atropine has following action except option A, bronchoconstriction, option B, tachycardia, option C, mydriasis, and option D, CNS stimulation. The pharmacodynamic actions of atropine is it causes bronchodilation and hence it is used in chronic obstructive pulmonary disease. In therapeutic doses, it blockades the M2 receptor of the heart and causes tachycardia. And it has passive mydriasis effect on eye as well as it causes CNS stimulation. So the correct answer of this question is option A, bronchoconstriction. Atropine has following action except bronchoconstriction. So question number 7. Which of the following drugs are used to reverse the effect of D2-bocurarin? Option A, atropine. Option B, neostigmine. Option C, physostigmine. And option D, organophosphorus. Here the correct answer for this question is option B, neostigmine. Here this D2-bocurarin, it is a non-depolarizing neuromuscular blocking drug, and to reverse its effect mainly cholinesterase inhibitors are used. So here this neostigmine, it is an anti-cholinesterase with pronounced action on NMJ junction, that is the neuromuscular junction. Question number 8. The ganglionic blocking drugs act by option A, competing with acetylcholine at neuromuscular junction. Option B, preventing release of acetylcholine. Option C, preventing nerve conduction in pre and post ganglionic segments. And option D, preventing the catecholamine release or inactivating it. So the answer for this question is option C, preventing the nerve conduction in the pre and post ganglionic segments. Next, question number 9. Essential drug is option A, drug that have been developed specifically to treat a rare medical condition. Option B, those drugs that satisfy the healthcare needs of the majority of the population. Option C, those drugs that satisfy the health needs of at least 50% of the population. And option D, drugs that is to be used within first hour of the acute attack of the disease. Here the correct answer for this question is option B, that is those drugs that satisfy the healthcare needs of the majority of the population. So here the option A, drugs used to treat the rare medical condition, they are called the orphan drugs, and the drugs that to be used within first hour of the acute attack, it is called the emergency drugs. So the correct answer is option B. Moving on to the question number 10. Acidic drug is more ionized at option A, alkaline pH, option B, acidic pH, option C, neutral pH, and option D, none. So as we know, all the drugs are either weakly acidic or weakly basic, and based on this their absorptions are carried out at different locations of the GIT. So this acidic drug is more ionized at alkaline pH, and acidic drug is more unionized at the acidic pH. So the correct answer for this question is option A, alkaline pH. Acidic drug is more ionized at alkaline pH. So the next question, which of the following drug causes organ toxicity on prolonged use due to accumulation? Option A, prednisolone, option B, chloroquine, option C, aspirin, and option D, hydralazine. The correct answer is option B, chloroquine. So question number 12. Which of the following cytochrome P450 isoenzyme is involved in the metabolism of largest number of drug in human? Option A, cytochrome 3A4, option B, cytochrome 2C9, option C, cytochrome 2E1, and option D, cytochrome 1A2. So the correct answer for this question is option A, cytochrome 3A4. Moving on to question number 13. Therapeutic drug monitoring is needed while using option A, MAO inhibitors, option B, lithium carbonate, option C, levodopa, and option D, antihypertensive drug. So the correct answer for this question is option B, lithium carbonate. So this lithium carbonate is a drug with narrow therapeutic index, and it is used for bipolar disorder. So since it is with narrow therapeutic index, we are doing therapeutic drug monitoring. And some of the examples of other drugs include digoxin, phenytoin, then aminoglycosides, etc. Moving on to the question 14. Adrenaline is inactive orally because option A, not absorbed from the gastrointestinal tract, option B, destroyed by the gastric acid, option C, completely metabolized in the intestinal mucosa and liver before reaching the systemic circulation, and option D, taken up by the adrenergic nerve endings of the intestinal wall, liver and lungs. So the correct answer for this question is option C, completely metabolized in the intestinal mucosa and liver before reaching the systemic circulation. Question number 15. Beta blockers with intrinsic sympathomimetic properties are option A, propranolol, option B, oxprenolol, option C, esmolol, and option D, metoprolol. The correct answer for this is option B, oxprenolol.